This is All India Radio. In the program Spotlight, now we bring you a discussion on containment strategies for COVID-19 pandemic. The participants are Dr. Narendra Saini, former Secretary General, IMA, and AIR Special Correspondent Mattu JP Singh.
Government is making all efforts for containing the spread of COVID-19. Containment strategies are being discussed and implemented to provide the best possible care. If we talk of Delhi first, COVID-19 testing in the national capital will be doubled within the next 2 days and tripled after 6 days in order to check the coronavirus spread. Dr. Saini, how will the house-to-house health surveys in the containment zones in the capital help in improving contact mapping?
If we see world over, corona epidemic has been there. New Zealand, US, Italy. The only way to limit this infection is testing, isolation, contact tracing. If we do this carefully, we can limit this infection. We can flatten the curve. So testing is the most important thing. So Delhi government saying that it will double this in next 2 days, along with the central government, help in 3 days, it will be triple. I think this is the right direction we are moving. If we see Bombay also, Dharavi, where we have been able to curtail infection to a limit is only because house contact tracing and testing. Similar things we have to do in every part of the country. Wherever the testing is limited, we have to increase.
In view of the scarcity of beds for corona patients in Delhi hospitals, Dr. Saini, the centre has decided to immediately provide 500 converted rail coaches to the Delhi government. How do you see this exemplary work being done by the railways in this regard?
I think it is really exemplary because at this moment of time, or I will say good point about corona or COVID disease is that you need limited resources to curtail this. As we say, 80% of people are safe at home. They do not need much medication, but 20% may need an oxygen. Where I think small kind of facilities make a lot of difference, saving lots of lives, like railways have done. There they have converted these into beds providing oxygen. That is the only thing which is required. So it will be a great booster for this kind of epidemic that we will be able to curtail it. Similarly, I have read it that central government and Delhi government are booking these banquet halls, schools and convert it into makeshift hospitals. I think if you see, we go back to history in the similar things that happen in China, similar things that happen in South Korea where they have converted these schools and into a makeshift hospital where you need limited resources like oxygen. If you provide oxygen, we can save hundreds and thousands of lives. So this is a good point which railway is doing, remarkable thing. And good point about railways is railway coaches. Wherever there is a need, we can shift them. Today, Delhi is needing it. Tomorrow, maybe some other states need it. They can be shifted there.
If we take a look at the recovery rate of COVID-19, this has now reached 51.07% in the country. ICMR is also continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. How do you look at the testing facilities at this point of time?
I think testing point of facilities are increasing, but more to be done on this part because testing is the only way. If we are talking of 4 states today, Delhi, Maharashtra, Gujarat and Tamil Nadu, they are the 4 states we are seeing high number of cases being there. But if you see that they are also doing high number of tests also. So it is limited to number of tests you are doing. So some other states also, I think, have to increase their testing capacity so that we are able to pinpoint the cases and then do the remedial measures which are required. Otherwise, this peak will never come. It will continue to grow. In 1 month, this state is growing. The other month, the other state will be keep on growing. And number of times we will not be able to know how many cases were there because they will go as undiagnosed. So important thing is testing. It has increased. We really are thankful to private labs and government labs and ICMR. They're doing remarkable job, but more testing to be done.
Dr. Saini, if we talk about tracking and monitoring of COVID patients, now this has to be very effective. So what are the standardized procedures that can be followed to achieve this, as the way to flatten the curve is testing, isolating and contact tracing as you just mentioned?
I will say is the implementation of process. Now there is no time to structure the whole healthcare system. If we say healthcare system in Kerala, which is very perfect there because in the health system, the admin is such a perfect way that you can reach to the lowest level where the patient is. But at present, in other places, the admin system of healthcare system is not that strong. At present, only is where we have done red zone, containment zone. We have to focus on these areas. Wherever the containment zones are there, where we have done the testing, do the contact tracing. Secondly, that app which we have made, Arogya Setu app, that should be made compulsorily because that will also reflect that wherever the system is not in place, there the Arogya Setu app will really help us. Make it compulsory like we have done that whosoever will be doing this public spitting or not using a mask, they will be having 500 rupees. So the similarly kind of some implementation process of Arogya Setu has to be here. I think at present, whatever central government is doing or the state government are saying, they are the perfect way of curtailing the infection, like using a mask, maintaining a physical distance, increasing the testing facilities and isolation of cases. But problem lies in implementation. We have seen number of people now moving around without a mask or not using the mask properly. So implementation is also a key mark on this. So we have to really work on whatever policies we are making, they are being implemented also.
If we talk about hydroxychloroquine, what role does it play in the treatment of COVID-19?
At one point of time, WHO saying that it is of no use, but recently again they have said yes, this should be used. We are putting on this is solidarity trial. They have again started with that. ICMR from the very beginning, it is saying that for a prophylactic purposes, it has been used and found to be very effective. So people who are healthcare workers or people who are staying with COVID positive patients in home quarantine, they should take this, but only on the recommendation of a doctor because it causes certain changes in the heart or certain people should not be given this hydroxychloroquine. So only on the recommendation of a doctor they should take it. And also those COVID patients who are coming positive, in that cases also ICMR has given an approval for 4 to 5 days of treatment with hydroxychloroquine that should be given. So use it judiciously as prescribed by a doctor, but it has a role.
WHO's chief scientist has said that the coronavirus mutations are not expected to alter the vaccine efficacy. It was also said that while it is difficult to predict when a vaccine will be ready or whether the samples being tested will meet WHO criteria, as per optimistic estimates, a vaccine may be ready by the end of this year. What are the challenges in developing a vaccine for COVID-19, Dr. Saini?
One challenge is that RNA viruses are known to mutate. It might be that once this vaccine is taking some time, at that point of time, some mutant of virus may come and it may not be effective again. That is one challenge. Second challenge is we presume that there is no mutation, but there are phase 1, phase 2, phase 3 trials. We are just at phase 1 or certain cases we are at a phase 2 trial. But in phase 3 trials, we ultimately come to know that will it be effective in a larger population or not. That phase is still to be there. Then third is it is to be produced for a large population. It is not only preparing that we know that this vaccination is effective, but producing that much quantity of a vaccination is another huge challenge. And then transportation of such a vaccine to different countries, again, this will be a great challenge. And fourthly, we still do not know whether this vaccine which we are producing will be giving a neutralizing antibodies or not and how long it will be effective. That will be again challenge because maybe we have able to produce this vaccine and after some time this virus mutates, then obviously this will go like influenza virus. We have seen influenza virus, we have making vaccine every year because it mutates so fast. Because this is a new virus, we are presuming that it will not mutate, but it can mutate also like other RNA virus does it. So we do not know all these things. So these are big challenges. There is a hope, but we should not depend only on this hope that yes, vaccine will come, only then we will talk about containment of this disease. No. Right now we have to do it, which we are doing, but more effective.
Yes, that brings us to the next question, Dr. Saini, that the centre has decided to constitute a committee of senior doctors in AIIMS so that the best practices in the fight against corona are communicated to the lowest level. What best practices do we see till now?
I have some reservation on that. One, we say, and it is true also, 75% of the health services are being given by the private sector. There has to be a coordination committee where private doctors has to be involved. Otherwise, you will make policies, but implementation might become poor, which is happening in many instances. We have to have the involvement of the private sector also, because they are constituting the 75% of care which is being provided to people. If we do not involve these players, then it will be very difficult to implement those processes which we envisage. So for an effective implementation, the policy has to be made in coordination with the private sector and then implemented with government and private. This has to be there.
Dr. Saini, you mentioned in the beginning about the example of New Zealand. We have the news that New Zealand is now completely free from COVID-19. By when can the infection be controlled in our country?
I just give you background of epidemiology, which we measure through R0 factor. R0 factor is that how many patients one patient gives the infection. If R0 is 1, it means it is flattening of the curve. If R0 is less than 1, it means we are going towards eliminating this infection. At present, in our country, R0 is more than 1. It is around 1.3 to 1.4, which is higher. But the only way, New Zealand, I quote you an example, how that country has been able to come to that low level of infection, or last 19 days, there is zero infection. They have come through only implementation of 3 things. One was using mask, physical distance, and testing. And wherever they found in testing people, quarantine, isolate those people. They have done only these 3 things, but very effective implementation. Unfortunately, at present, implementation process is some states are doing fine, some states are not doing fine. So at present, very difficult to predict when. But if I see today the curve, how it is going up, probably in the month of July last or in early August, we can see a flattening of curve and going down.
And that's a very positive note, Dr. Saini.
Positive note is only, I repeat, only when the society as a whole will say that this is my role also, not only the role of a state government or a central government. I am also involved in this war, where each and every one of us will feel that, where I isolate myself. Whenever it is not required to go out, I will not go. But if I had to go, then I will use the mask and maintain a physical distance. If all of us as a society think about that we have to win this war, we can do it in July also.
And Dr. Saini, you just spoke about the steps which we should take to keep ourselves secure and safe. And again, if I would say that we are in unlockdown phase, what best measures we should follow that we remain safe while we work?
When we work, we should avoid going to larger gatherings. Already there is a law that you cannot have more than 3, but even that we can avoid it if it is there. Then when we maintaining a physical distance, as I said, when we are working in an AC environment, make sure that we keep some air circulation also inside that, keeping some part of the door open or some window open so that there is an air circulation is there. When we are working at a place, then we all should not like a lunchtime and we all go together for a lunch or a tea together. We should avoid such kind of meetings, avoid such kind of gathering. And when we go home, first thing should we do, we must hand wash, and we are really have been able to come in contact with some positive patient, then we must first take out our clothes, wash them and take a bath, so that other people are not infected. One of the foremost thing is that the problem here is not to young people, not to children, but severity of the infection is more in cases of older people or people who are diabetic or hypertensive. So the young people have to take more care that when they go home, they must make sure that they are changing their clothes, they are hand washing, they are keeping a distance from their parents so that they are not infected, because as we have seen, many patients are asymptomatic, but they are carrying the virus, which can be transmitted to others. So maintaining that physical distance is very important. We have seen worldwide studies are there. Using a mask reduces 40% of transmission of infection. So when we are meeting our parents, even at home, I will say, when you are coming from outside, keep your mask on so that you are keeping this. And I will advise all my older people out there that they should not move out from their home.
Thank you for joining us on the program.
Thank you.
You were listening to a discussion on containment strategies for COVID-19 pandemic. The participants were Dr. Narendra Saini, former Secretary General, IMA, and AIR Special Correspondent Mattu J.P. Singh. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our website, newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.